If you suffer with painful varicose and spider veins, our next guest says she will determine whether your veins are cosmetic or medical and teach you why you have varicose veins in the first place. This is Terry Morrison. She's a registered nurse and she's the co-owner of Morrison Vein Institute. And you're going to teach us all about compression stockings and socks. Great to see you. First off, what are the health benefits of wearing compression stockings and socks?
Well, with properly fitted compression socks, not just the kind you buy over the counter in those little leg cartoon type of commercials, they actually bring your vein blood back to your heart. In other words, arteries make your blood go down to your legs, and your veins bring that blood back to your heart.
And that's important because it can prevent inflammation problems,
yes,
right?
Inflammation that leads to blood clots, and we don't want anyone to have blood clots.
All right, so let's forget about the little the stockings that you said that we buy in the little cart. You have on some snazzy ones, and you brought some really cute ones along with you. These are fashion.
Yes, we want them to know that it's not what your grandma used to wear.
Right, look at these.
But they have the same, we call them a dosage. So you can get 20, 30, 30, 40. Your insurance company makes you wear a 20 weight stocking. Okay. So it's not just those little white stockings that you had when you went to surgery.
These are cute.
So we have sports socks for men and we have fashionable socks for women and men because we actually want them to wear something to the knee or thigh high or pantyhose.
And you'll tell us the dosage that we need?
Yes.
Okay, I didn't realize there was a dosage. It's like glasses. I didn't realize that. Tell us about this new glue treatment that you're doing.
Okay, we have to be able to close a diseased vein with something. And so most people are used to talking about laser ablation, radio frequency ablation, foam sclerotherapy. Everybody knows there's some way to close a diseased vein. Now those are the veins inside. Those aren't the ones you and I can see that are peeking out on the surface. Okay. So you have to treat the plumbing, I tell patients. If you have a leaky ceiling and you see that leak on the ceiling, you have to fix the plumbing. So with glue, you don't have to wear compression stockings for 3 months before. You have the veins treated with glue. It's like having an IV started. There's one little poke hole like an IV. The tubing is threaded up into that diseased vein, and they pull back, and they call it, instead of a dollop of glue, they call them an aliquot of glue. And once they pull that out and seal it, we put a Band-Aid on their leg, and they can go right to exercise, right to work. No compression stockings.
You're gluing it up, and so no compression stockings at all.
No, because there's no heat.
Right. So are veins a disease?
Veins are a disease. A lot of people don't know that because we inherit the genetic factor to have weak vein walls or weak vein valves, or some people have both.
Is there a cure?
There's not really a cure. We call it maintenance. Now, we can turn back the clock on somebody that has covered in veins or large varicose veins or swelling without even any veins. And it's like turning back the clock, fixing all your teeth at the same time.
But it's not a one-time fix.
No, gradually your body has those same genetic factors, and you're going to slowly see other veins if you don't have maintenance.
And yearly checkup, you said.
Yearly
checkups.
Good.
Okay, let's give you some information. Go ahead and get your veins fixed once and for all. Morrison Vein Institute. They're located at 6301 South McClintock Drive, Suite 115 in Tempe. To book your appointment today, 480-775-8460, or visit their website, morrisonvein.com.